Hi, I'm Kim Stevens here in the Fox 26 Newsroom. Have you ever heard of the term the sandwich generation? It is the generation of adults who are taking care of their own families, but they are also taking care of older loved ones as well. And this is at a time when maybe they're talking about or thinking about retirement, going to cut back a little bit at work and go have fun and do things and travel. But oh, shoot, somebody is sick or their health is changing and it's time to care for them as they cared for you. Well, there are a lot of families who are going through this right now, but you don't have to go through it alone, and you don't have to reinvent the wheel and figure it out all on your own by yourself. Dr. Macie Smith is a gerontologist and a licensed social worker who has been in this field for well over 20 years, I think nearly 25 years. And Dr. Smith, you wrote this book that is a dementia caregiver called to action, the journey. And thank you. It's an amazing book.
Well, it was my pleasure. Thank you so much for saying that, Kim.
It's easy to read and easy to follow and understand. And I have highlighted all the way through the book because I have found so many things that just speak to me or other family or friends who are going through things. So first, let's talk about, you bring the word dementia. Can you explain what that is and how does it relate to Alzheimer's?
Thank you for starting off with that question, and thank you for sharing your thoughts on the very compact read, and that it was intentional. Wanted to be sure that family caregivers who really don't have time to read, to be able to have tangible resources at glance of an eye, to be able to positively impact their journey. Dementia itself is not the actual disease. Dementia is a group of symptoms or a set of behaviors that a person displays as a result of having a condition that's impairing their cognitive and their intellectual ability. So the memory loss, the forgetfulness, the agitation, inability to perform familiar tasks, something causes that. There are over 100 causes of dementia, Kim. Alzheimer's disease just happens to be the number one type or the most common cause of dementia.
And according to who did I say it? I saw it from, I don't know if it was the Alzheimer's Association or something that said 40, Alzheimer's accounts, like you said, for 60% of those people living with dementia, women are at higher risk of developing Alzheimer's, but they're also more likely to be the caregiver in the sandwich, if you will.
That's exactly right. And there are over 11 million Americans who are caregivers or caregiving for someone with Alzheimer's disease. But 22% of the US population, the working population, they're also family caregivers. And so stress is a contributing factor to developing Alzheimer's disease. And so when we think about women in general, we are natural nurturers. A lot of times we're giving of ourselves and we're not taking care of ourselves. We're not even recognizing medical emergencies on our part because we're so busy pouring in to other people. And so in addition to women having the APOE-4 gene code, which puts you at higher risk of developing it, doesn't mean that you're going to get it if you have the gene code, but with the genetics and also with our lifestyle as women, and then African-American women are 2 times more likely to develop Alzheimer's disease than their Caucasian counterparts.
Wow. So with this knowledge, is that a message to us to when we're not showing signs, we believe that we're healthy and younger, that we need to calm ourselves down? We need to find ways to take care of ourselves and try to keep the stress to a low level?
I agree 100%. And you always want to put yourself first. It's not selfish. It is very insightful and intuitive to put yourself first so that way you can be healthy to take care of the people who you value and uplift the most. What we know now, Kim, that we did not know before is that approximately a quarter of the dementias that we see could possibly be prevented with maintaining and practicing healthy lifestyle. So watching what you eat, not watch it as it goes into your mouth, but
Yeah.
making good choices as it relates to your diet, eating foods that are heart healthy. If it's heart healthy, they're also brain healthy. You want to exercise and stay engaged at least 5 times a week for 30 minutes a day. You want to stay engaged with other people. You want to get the right amount of sleep. Adults, people, you should get, or we should get 7 to 9 hours of sleep every night because it repairs the damage from the brain. And when you don't manage and you don't practice a healthy lifestyle, in addition to managing stress, you increase your risk. Lifelong learning, Kim, you got to read new information. You got to learn new skills. You got to keep those neurons firing off to build a cognitive reserve. So if you were to be in line to develop Alzheimer's disease, you could actually delay the symptoms, which would be dementia, because you built up a cognitive reserve.
Okay. Well, hey, ladies, we heard that and we will subscribe. Now, let's say we get to the point or caregiving. Let's talk about some symptoms of dementia. We usually think of somebody forgetting something. But if I walk into a room and all of a sudden I say, Dr. Smith, I came here to talk to you, but I can't remember why. That's not real cause for concern with our memory loss, is it?
It's not. That is considered normal age memory impairment. And that's what I addressed early on in the book, the difference between actual dementia and normal age memory impairment. Now, if that begins to happen more often and it becomes more pervasive, then it could be an issue. Dementia is much more than simple memory loss and forgetfulness. That memory loss and forgetfulness has to impair your life, has to impair your day to day. If you're forgetting more often than the average person your age and your condition, and it's causing stress, it's causing distress, it's causing you to miss appointments, it's causing you to get lost in familiar places, that's when you could be dealing with dementia. And that's when you want to make an appointment to your primary care doctor. Don't go to the hospital because there are hospitalists there. Those hospitalists don't know you. They don't know your history. So they may treat what they see and it may not be accurate. And as we get older, over the age of 65, there are certain medications, behavioral health medications being one group, that seniors just can't take and be successful if they don't need it. So you just want to be mindful of that. Your primary care doctor is who you want to see. And if a senior is prescribed a behavioral health medication, you want to, weigh the benefits and the risk, because that is a group of medications that are not recommended for the aging population.
Okay. Now, I have a friend who was telling me that she was thinking that her father was going through, that he was having cognitive issues. And she was trying to get him to go to the doctor, but he refused. And finally, something happened where he had some sort of, it wasn't an emergency, but it was something where he had to go. And she said, thank goodness, because now I can actually follow some advice that you even gave in this book about have a conversation with the doctor and say, these are some things I'm seeing. My dad's not going to say it's happening, but it is.
That's right. And I also talk about family members, try to not take over their life, but try to partner in their care. You want to be listed on their HIPAA form so that way the doctor can talk to you about medical information. If there is access to an electronic medical record, you want to set your loved one up with the username and password. That way you can communicate with the doctor seamlessly without your loved one knowing, because sometimes they really do get upset because the last thing they want to lose is their mind. So Surely he probably didn't want to go to the doctor because he may have been experiencing these things for some time and he may be in denial. And so when we start to force those types of things on them, we don't get good results. And so you want to prepare in advance as early as possible. In the event something does happen that you have to communicate some, undesirable things with the doctor, you're already prepared to do so and you have access to do that.
You know, one thing that you wrote in here that I found really enlightening, I did not know, is that there are other issues that happen in the body that can make someone forgetful or have challenges with their memory, like, for instance, a urinary tract infection.
UTIs are so prevalent in
Yeah.
our aging population because they're not drinking, well, drinking water. They're not
Yeah.
hydrating themselves. They're not as active. They may be more in an isolating role. So they're home alone by themselves. They're not engaged. And so they do develop UTIs and they develop them often. And so to family members or to professionals working with them, it looks like they have full-on dementia, but that is because the infection has been brewing, for lack of a better word, in their body, and they could have become sepsis. And when you become sepsis, it does attack and affect your cognitive ability, increases disorientation, it increases aggression because they're in pain, but they cannot fix it. And so I always talk about early on and in the book, ruling out treatable causes of dementia first before accepting a long-lasting diagnosis of Alzheimer's or a progressive type of dementia.
Yeah,
Depression
like,
is another one, Kim. Depression
yes,
looks just like dementia
say
on
that
someone
again.
who's over the age of 65.
Wow. And then you said also lack of sleep, depression from a traumatic event. Maybe you lost your spouse, medicine interaction, diabetes, thyroid imbalance, vitamin B12. My gosh, lots
Yeah.
of things.
And this is not everything. These are the most common causes. This is what I tend to see in my practice more times than not. And so when a family calls me about their loved one having possible dementia, I go through all of the treatable causes first. And you'll be amazed. I would say probably about 25%, they were either dealing with a UTI, they were dealing with blood sugar, being high or being too low, so being pre-diabetic. In one case, I had someone who was dealing with thyroid issues, which caused those dementia-like symptoms because those areas and those conditions, they affect your neurological state, your cognitive ability. And so it's very important to know what those things are so you can have those meaningful conversations with the doctor. And in addition to that, your loved one may be more receptive to going to the doctor to take a look at their vitamin levels, their blood sugar levels, as opposed to going to the doctor to check their brain out because they might have dementia.
Exactly. Oh my gosh. And, you also talk about trying to ensure that your loved one is seeing the same doctor and getting all of their medicine from the same pharmacy so that all of the information is easy to see and see about the interactions.
Absolutely, too, Kim. And what I try to do is help family caregivers and families build a support system that they really did not know that they needed. They don't have time to be calling different pharmacies and calling different doctors trying to figure things out. Things are splintered and scattered. If you have that one pharmacy, that pharmacist can do a medication reconciliation any time of day. They can see whether or not medications are interacting with each other. They can also help you communicate with the doctor's office. So you don't have to do it by yourself. These are things that exist. The problem is, Kim, families don't know. And I want families to have my book as a starting point. It's not the end all be all, but it is a starting point to get that conversation going, get you to understand what that process looks like going forward, and gives you the hope and the permission to intervene where necessary with real-time, credible information.
Absolutely. Now, as we've gone through the first part of the book, as we've just been talking about, the next part is what do you do if you do get a diagnosis? And there are a lot of questions to ask, but also information for us to better understand. So, what is then your next piece of advice?
Once the diagnosis is solidified, it's nothing treatable. It is what it is. So I help family caregivers create a care team Who should be on that team? I talk about the neurologist. I talk about addressing and assessing paid support, whether or not the paid support should come into the home, whether or not you should look for out-of-home care, what questions you should ask when you're interviewing in-home care providers and out-of-home facilities. There are certain things I tell you to look for. I also talk about what you should look for if you're considering or when to consider bringing your loved one home to live with you. That may not always be a good idea. And I want caregivers to understand that there are going to be people in their life, people who they love, sometimes people who they don't like very much, who are going to cast shame, cast judgment on them if they look for out-of-home placement for their loved one, but they don't have to do the work, right? Yeah. And so I talk through the book and the words, talk to family caregivers on what to consider and when these decisions may need to be made. I also address the emotions that the family caregivers are now going to be dealing with, because now you know that this is, what it is, and this is what our life might look like going forward, because it's not a person living with dementia. It is a family living with dementia. And so I give caregivers permission to feel all their feels whenever they feel it, and it's normal. A lot of times family caregivers and women in general, we feel like we can't show our feelings. We feel like we have to be top tier all the time. That's stressful. I can't be top tier all the time. And so you want to be vulnerable and transparent in moments, so that way you can be receptive of the support that is available. And so, I talk about, getting an elder care attorney, a certified elder care attorney to help with planning, right? Preserving your assets, because long-term care is not cheap. I go into what long-term services and supports are, because you hear that term, but who really knows what that means? Well, I tell you exactly what it means, and I tell you how to talk through it. I tell you how to work through it, and I tell you who should be on your team to help you and your loved ones navigate that journey ahead.
Now, one thing that's been common in our family has been, I want to stay home and I don't want to go anywhere, but I don't want anyone in my house. What do you say to that?
Oh gosh, that is so true. So in those situations, families, when they see that they're like hitting a brick wall, you can actually reach out for third party support, which is through a geriatric care manager. So I have a geriatric care management practice, and I'm the bad guy. If the daughter is a caregiver and she's bumping heads with her dad who has dementia, then sometimes you want to bring in a third party to help mediate and to help develop a plan of care. Typically, they listen to that person over there because they're credentialed. Susie, you not credentialed, you my daughter. So you stay in your place. Yeah. And so we come in and create a care plan and make recommendations. When recommendations come from the professional, they're more apt to be receptive. And if I encounter someone who does not want anybody in the house touching their stuff because they might steal it, I flip it and say, maybe, you may need some assistance with house cleaning. You may want someone to transport you to the grocery store or to the doctor, but you're in charge now. You decide who you want to come and you decide what you want them to do. And so when you elevate them and let them know that they're still in control of their life, then you'll get more buy-in.
Wonderful. Yeah. Not taking all of the choice and, independence out of life.
Oh, but no, you can't. And when you remove choice, you remove their independence. Think about you and I. If we can't choose what we want to wear, or we can't choose when we want to go and when we want to come home, we get a little belligerent too, don't we?
Yeah. That's true. That's a good point. Yeah. But for the families who do need to or choose to have their loved one go stay somewhere else and get cared for, there is a common sentence that is said that is heartbreaking. You're already feeling guilt, not that you deserve to, but we do. And that is your loved one saying, I want to go home.
It is heartbreaking. Everybody is different. When you've met one person living with Alzheimer's or dementia, you've met that one person. You know, I often tell families, it's very, very difficult to make that decision, but it's very similar to what you mentioned earlier. Sometimes you really do have to wait until there's an episode. And if there is ever an episode where they have to go out of the home for any type of doctor's appointment or any medical care, that is your window of opportunity to make that transition.
Yeah.
When they start asking to go home, that's when the art of redirection comes into play, knowing what to say and how to redirect the conversation. I'll give you just one little tip that I typically use. The person is always there for therapy. They're always there for therapy. And whenever therapy is completed, then we can look at what other options are available. They're always going to get therapy. It could be physical therapy or it could be activity therapy, right? And so you don't want to say you're never going to go home. That's negative. That's, hopeless. When you lose hope, you lose life. And so you want to figure out what to say in terms of the art of distraction, things that's going to make them happy, not necessarily a lie, but things that are going to be therapeutic to get them through that moment. You always want to bring things that are familiar to them, that make them feel comfortable in those long-term care communities. But you want to be careful with that, because if you bring too much stuff from the house, they're going to think, I'm never going home. And you might have a different response. So like I said earlier, everybody is different. And so you got to really judge and gauge, how much you can provide for this particular scenario. But in the book, I just give you a couple of scenarios. And then from there, you kind of know what to do. And then you can build from there.
Yeah, and that's the thing I found so helpful with this is that if this, then this, but if this, then this. And it also gives the reader choices and empowerment too.
That is true, because even though it's good for the person living with dementia, the caregiver has to be the one that can execute it. Now, if you don't know how to lie real good, then you might not be the one to do the therapeutic fib, because you're going to forget what you said, right? And they still have their wherewithal. My grandma had dementia, and she always thought somebody was stealing her pots. And one day I said, Grandma, I'm going to go out there and I'm going to talk to that lady so she won't come back in here. And when I came back in the house, I said, I talked to her. My grandmama said, well, I didn't see nobody out there. And I was like, well, she left early, so you got to be prepared. And if it's not something that you're able to do, then don't do it. It may be someone else. We call it rescuing. Someone else who they trust and love can come and take on that role. And so that's one of the things that I do as the geriatric care manager. I do family consultations to help compartmentalize the roles, because a lot of times people, just say siblings, they don't want to take on any responsibility because they think they're going to be taking on all the responsibility. But that's not true. If this particular sibling is good with finances, they're going to manage the finances and pay the bills. If this person is good with day to day, then this is the person that's probably going to come over every day, make sure mom has something to eat, make sure she's bathed, and spend time with her. And that person may have the most patience. And so when you're in a family and there's family dynamics, that's one of the things you may want to do. If you don't call in a care manager, maybe that's somebody can take the lead and say, compartmentalize the responsibilities and say who should do what.
You're absolutely you speaking to my family. My dad had to have knee surgery, so my brother went to take care of him and my mom together. And he would call me and say, this is not my forte. I am not a good caregiver. And so we started to have that conversation. Figure out what our strengths were and play to those instead.
That's exactly right. And really, when you do that, then you can pair people up with the right responsibility. When you don't do any type of assessment, informal or formal, then you'll have people doing things that are stressful. And if that caregiver is stressed, that person living with dementia, they're going to feel and be stressed as well. And what that does, Kim, is it causes the disease to go a lot faster, which is going to require more work on your part as a caregiver sooner than necessary.
Oh, all right. Thank you. One final thought of advice to anybody out there who's watching this, listening and saying, oh my gosh, you're speaking to me.
Oh, I'm glad I'm speaking to you. That means you have, listening ears.
Yeah.
I want you to get connected to your AAA, the local AAA. There's a AAA in every state, in every county. That's the Area Agency on Aging. My book closes out with resources. It's not all the resources, but it's a great starting point for resources. Don't be afraid to ask for help. Don't be afraid to look for help. But the only concern I have with looking for help is that when you go out on the internet, too much information is just as bad as not enough information. And so I feel like I did a really good job just really gauging the information that's out there based on my professional and personal experience. And I think I've prepared a really good starting point for you as a caregiver. So help us out there.
How do we get the book, by the way?
It is on Amazon. It's also on Barnes & Noble, everywhere you get your books. It's available as a paperback like Kim has. And it's also available as a Kindle. So you can download it and have it on your device. And just say, if you go to the doctor, you will probably say, oh, Dr. Macie said something about that. And even though the book is compact, Kim, you're going to refer back to it over and over again because you're going to be faced with a new situation. And more than likely, I've covered it.
Indeed. I was going to share this with my friend, but no, I'm getting her own copy. So yeah.
The more the merrier. And the information is translational. If you're not dealing with it in your family right now, you probably know someone who is. So it may be a great Christmas gift.
Very good. Yes. Dr. Macie Smith, thank you so very much for your time, for your insight, enlightenment, and encouragement. Much appreciated.
Thank you so much for having me.